The name of Dr. Russel Norman.
Mr. Speaker, my question is to the Minister for Social Development and asks, will she set specific targets for reducing child poverty? If so, what child poverty measures will she use?
Mr. Speaker.
Honourable Paula Bennett.
Mr. Speaker, this government has committed to 4 better public service targets that will help children. They are reducing long-term welfare dependency, increasing participation in early childhood education, increasing rates of immunisation and decreasing the incidence of rheumatic fever and reducing the number of assaults on children. Added to that are targets related to the economy and jobs, which of course have a direct impact on child poverty. There are a number of measures of poverty, and the Child Poverty Monitor that was released yesterday itself also recognised the complexity of the issue and used a range of measures.
Supplementary.
Supplementary question, Dr. Russel Norman.
Thank you, Mr. Speaker. So can the Minister answer the primary question, which is, will she set specific targets for reducing child poverty?
Mr. Speaker.
Honourable Paula Bennett.
We already have.
Supplementary.
Order. Supplementary question, Dr. Russel Norman.
Thank you, Mr. Speaker. Can the Minister tell the House what are the specific measures of the targets for reducing child poverty?
Well, Mr. Speaker,
Honourable Paula Bennett.
As I've said, child poverty is multidimensional and there is a multi-measure approach. In fact, MSD has a strong position in that no single measure can actually properly capture the different aspects of poverty, and we therefore use the multi-measure approach. We are open and transparent in reporting that. In fact, the information that was used for the Child Poverty Monitor yesterday itself actually used all of the information that MSD itself reports. Those reports show that it's been in a flat line for the last 3 to 4 years, which, considering the global financial crisis that we went through, shows that we have actually been quite remarkable, I think, in keeping it there. But there is absolutely no doubt about it that we need to do more work, and that's what we're concentrating on.
Supplementary.
Order. Supplementary question, Dr. Russel Norman.
Thank you, Mr. Speaker. Given that the Minister says that there are many measures of child poverty, would she care to pick one of those measures of child poverty specifically, and tell us what her target is for that measure of child poverty?
Honourable Paula Bennett.
Mr. Speaker, will it be quite easy for me to go to the better public service target of 90% of 8-month-olds are fully immunised by December 2014, and that 90% of 8-month-olds nationally had completed scheduled vaccinations. Also, Mr. Speaker, reducing the incidence of rheumatic fever by 2/3 to 1.4 cases per 100,000 is a real target that this government has set and has a direct impact, and of course it's all about child poverty.
Supplementary.
Supplementary question, Dr. Russel Norman.
Thank you, Mr. Speaker. Well, I appreciate the Minister...
Order. Just come to the supplementary question.
Thank you, Mr. Speaker. Well, can the Minister tell the House that, aside from the targets she mentioned about immunisation and rheumatic fever, which are health targets, could she tell us what is one specific child poverty target that actually addresses the measures of child poverty as identified by the Children's Commission?
Mr. Speaker.
Honourable Paula Bennett.
So the member in his question raised both measures and targets. So what we have is a multidimensional measures because of the complexity of the issue, which we report on through the MSD household incomes and which we saw in the report yesterday. So there's your answer on your measures. Another target that I can well and truly point to is actually us addressing the economy and making sure that we have more jobs and better paying jobs for New Zealanders. Unless we get that right, quite frankly, we are not doing the best by those children that need us.
Supplementary.
Supplementary question, Dr. Russel Norman.
Thank you, Mr. Speaker. Does the Minister believe that she has responsibility for the rates of child poverty, and hence how does she measure the rates of child poverty?
Mr. Speaker.
Honourable Paula Bennett.
I believe that all of us do.
Supplementary.
Supplementary question, Dr. Russel Norman.
Thank you, Mr. Speaker. Without an official measure of child poverty, because the Minister has failed to provide one so far, how can she possibly know if the policies she is promoting are working or not without some measure to determine rates of child poverty?
Mr Speaker.
Honourable Paula Bennett.
Well, as I've stated, there is a number of measures. They are reported on. The member himself can point to them and then hold the government to account if he wishes to. Quite frankly, Australia and Canada are the same as us and use multi-measures and don't have just one. Actually, to use just one would not be actually getting into the depth of what is a very complex issue.
Supplementary.
Supplementary question, Dr Russell Norman.
Thank you, Mr Speaker. Does the Minister believe that Mr Mandela was right when he said that overcoming poverty is an act of justice, and hence her failure as a minister in 5 years to overcome poverty means that 1 in 4 children are now still living in poverty, 1 in 10 children are living in extreme poverty? Is that a matter of justice for those children, or are they still living with injustice?
Honourable Paula Bennett.
Mr Speaker, I don't have responsibility for the first half, but what I would say is that actually we take the care and the well-being of those children incredibly seriously. We have a number of issues that we are actually addressing. It is not one simple one that will actually fix this. We have flatlined over the last 3 years. We would like to do better than that, and we will. But at the moment, what we are concentrating on is the actions that they need on the ground. I can talk about the $1.5 million that's gone into KidsCan. I can talk about the food in schools that we're supporting through Kickstart to make sure that they have breakfast and lunch in schools. I can talk a lot about the microfinance scheme that we're getting up and running. I can talk about warranted fitnesses for houses. I can talk about 240,000 homes that have now been warmed up. I can talk about the extra bedrooms that are going on to state homes.
Question number 2, David Bennett.
Mr Speaker, my question is to the Minister of Finance. What progress has